Hello everyone and welcome to Module 12 of the PSW NACC exam. This module covers questions for health conditions and we'll be starting right off with question 1. What is the function of insulin that helps the body? A. Grow in height. B. Use of glucose. C. Clotting of blood. D. Fight off infection. In option A, growth is primarily influenced by growth hormones and not insulin. Insulin is a hormone produced by the pancreas that plays a crucial role in regulating blood sugar levels. For option C, blood clotting involves platelets and clotting factors, but not insulin. And in option D, it is the immune system that fights infections, although poorly controlled diabetes can impair the immune function indirectly. So with respect to the options we have, our answer is option B. Insulin allows the body's cells to absorb and use glucose from the bloodstream for energy or storage. This process is vital for maintaining normal blood sugar levels and providing energy to the body. Question 2. What is the primary role of a PSW when supporting a client with diabetes? A. Administering insulin injections directly. B. Monitoring blood sugar levels and reporting abnormalities. C. Deciding on the client's dietary changes. D. Diagnosing complications related to diabetes. In option A, PSWs are not authorized to administer insulin unless they have been specially trained and permitted under provincial regulations. This task is usually performed by nurses or by the clients themselves. The role of a personal support worker when supporting a client with diabetes is to monitor for changes in the client's condition, such as their blood sugar level, and to report abnormalities to the healthcare team. This will ensure a timely intervention and help to prevent complications like hypoglycemia or hyperglycemia. In option C, a PSW can assist with following a prescribed diet plan but does not have the authority to make dietary decisions. This responsibility is for the healthcare professionals like the dietitians or the doctors. In option D, diagnosing medical conditions is outside the scope of a PSW's duties. They are only trained to observe, report, and provide supportive care, but not to diagnose. So our answer here is option B. By focusing on observation, reporting, and following care plans, the PSWs play a vital role in managing the health and well-being of clients with diabetes. Question 3. What are the signs and symptoms of fractures? A. Bleeding. B. Swelling. C. Limbs looking bent or out of position. D. All of the above. In option A, if the fracture is an open fracture, the bone may break through the skin, causing external bleeding. For option B, swelling occurs due to tissue damage and the body's inflammatory response to the injury. In option C, a visible deformity such as a limb appearing misaligned or bent unnaturally is a hallmark sign of a fracture. So our answer here would be all of the above. All the options listed are signs and symptoms of fractures. These symptoms are usually accompanied with severe pain, reduced mobility, and tenderness at the site of injury. So recognizing these signs ensures a timely medical intervention and care for the injured person. Question 4. Mr. Rex has had his larynx removed due to cancer. What will he be unable to do? A. Sneeze. B. Swallow. C. Speak. D. Cough. Sneezing is controlled by the nasal passages and the nervous system and not the larynx, so Mr. Rex can still sneeze. Swallowing involves the esophagus and related muscles, but not the larynx. The larynx, which is also known as the voice box, is responsible for producing sound and enabling speech. So when the larynx is removed due to conditions like cancer, the individual loses their ability to speak naturally. There are alternative methods such as the esophageal speech and electrolarynx devices that can help the person to communicate. For option D, although coughing involves the larynx, individuals without the larynx can still cough by using their trachea and respiratory muscles. So our answer here is option C. When the larynx is removed, the individual will lose their ability to speak naturally. Question 5. What is the condition of having small pouches on the colon that bulges outward referred to? A. Diverticulosis. B. Tuberculosis. C. Fibromyalgia. D. Gangrene. Diverticulosis is the condition where small pouches form and bulge outward in the wall of the colon. These pouches often occur due to increased pressure within the colon, and they are often asymptomatic. However, if one of these pouches becomes infected or inflamed, it can lead to a more serious condition known as diverticulitis. Tuberculosis is a bacterial infection that affects the lungs, although it can affect other organs. However, based on the question, it is unrelated to the condition of the colon. Fibromyalgia is a chronic condition that causes widespread musculoskeletal pain and tenderness, but it doesn't have any issue with the colon. Gangrene refers to the death of body tissue due to infection, lack of blood flow, or injury. However, it is unrelated to the formation of pouches in the colon. So our answer here is option A. Diverticulosis is typically seen in older adults, and it is often discovered incidentally during routine screenings like colonoscopies. The condition can cause symptoms like bloating, abdominal pain, and changes in bowel habits, but many people may not experience these symptoms at all. Question 6. How many muscles form the human body? A. 200. B. 350. C. 500. D. 650. We'll begin with option D here. The human body contains approximately 650 skeletal muscles, and these work to provide movement, posture, and support. These muscles are voluntary, meaning that they are controlled consciously. Although there are smooth muscles, which are involuntary muscles like those in the digestive tract, and also the one in the heart known as the cardiac muscle, they are not included in the skeletal muscle count. Skeletal muscles enable movements by working with the bones and joints. Smooth muscles, which are found in the internal organs, regulate functions like digestion and blood flow, while cardiac muscles is unique to the heart and it pumps blood throughout the body. Question 7. What is a complication from vomiting? A. Duodenal ulcer. B. Fluid retention. C. Aspiration. D. Myocardial infarction. Duodenal ulcer is caused by factors like excessive stomach acid or infection with Helicobacter pylori, but not by vomiting. Vomiting leads to fluid loss and dehydration, but not retention. So option B is not our answer. For option C, vomiting can lead to aspiration, and this occurs when the vomit is inhaled into the lungs instead of being expelled from the body. This can lead to serious complications like aspiration pneumonia, where the lungs become infected or inflamed due to the presence of foreign material. In option D, myocardial infarction is also known as heart attack, and it is caused by reduced blood flow to the heart, but not directly by vomiting. So our answer based on the options we have here is option C, aspiration. It is very dangerous, especially in individuals who are unconscious, weak, or have impaired swallowing reflexes. Question 8. Structures in the respiratory system includes A. Larynx, heart, and sinuses. B. nose, trachea, and alveoli. C. Heart, lungs, and teeth. D. Mouth, esophagus, and lungs. The respiratory system includes various structures that works together to facilitate the exchange of gases, which is oxygen and carbon dioxide, between the body and the environment. The key components of the respiratory system are the nose, the trachea, and the alveoli. The nose is the entry point for air, and this is where air is filtered, warmed, and moistened. The trachea is the windpipe, and this is the passage that directs the air from the nose to the lungs, while the alveoli are the tiny sacs in the lungs where gas exchange occurs. Based on the options we've been given, option A is not the answer because the larynx is a part of the respiratory system. However, the heart and sinuses are not. The heart is part of the circulatory system. In option C, heart, lungs, and teeth is also not the correct answer because they belong to different systems in the body. The heart belongs to the circulatory system. The teeth are part of the digestive system. In option D, the esophagus is part of the digestive system, while the mouth is involved in the intake of air. But the esophagus is not directly part of respiration. So with respect to the options, our answer is option B. Nose, trachea, and alveoli are part of the respiratory system. Question 9. Which of the following is a common symptom of a urinary tract infection? A. Increased appetite. B. Burning sensation during urination. C. Sudden weight gain. D. Difficulty breathing. A urinary tract infection causes symptoms like pelvic pain or discomfort, especially in women, cloudy or strong smelling urine, frequent urge to urinate, even when the bladder is not full, and burning sensation during urination. This is one of the most common and uncomfortable symptoms of a UTI. Looking at the options we have, option A, increased appetite, is not a symptom of a UTI. Option B, we've mentioned earlier, is a symptom of a UTI, burning sensation during urination. Option C is not typical of a UTI. Weight gain could be related to other conditions like heart or kidney disease. And option D, although it is a symptom, it is not associated with having a UTI. Breathing problems can indicate respiratory infections or other serious conditions like pneumonia. So our answer here is option B. Burning sensation during urination is a common symptom of a urinary tract infection. Question 10. What is an essential component of care for a client with chronic obstructive pulmonary disease? A. Encouraging vigorous physical exercise. B. Monitoring oxygen therapy and ensuring proper use. C. Restricting fluid intake to reduce respiratory efforts. D. Avoiding all physical activity. In option A, while physical activity is important for managing COPD, vigorous exercise is not recommended for most COPD patients, especially those with severe symptoms. Exercise should be tailored to the patient's ability, and it typically involves low-intensity activities in order to improve endurance. In option B, an essential component of care for a patient or clients with chronic obstructive pulmonary disease is monitoring their oxygen therapy and ensuring that it is used properly. Oxygen therapy is often prescribed for COPD patients who have low oxygen levels in their blood. This will help to improve the oxygen supply to the body, reduce symptoms like shortness of breath, and improve their quality of life. Option C is not recommended for COPD patients. In fact, staying well hydrated is important for thinning mucus and aiding in its clearance. And in option D, complete avoidance of physical activity is not recommended either. While rest may be necessary during exacerbations, regular low-impact activity like walking can help to improve the lung function. So for this, we'll be going with option B. Question 11. Osteoarthritis will most often affect A. Young adults, B. Young children, C. Teenagers, D. People over the age of 40. Osteoarthritis is a degenerative joint disease that is commonly seen in individuals over the age of 40. It is primarily caused by the wear and tear of the cartilage in joints, which can lead to pain, stiffness, swelling, and reduced mobility. Now, while osteoarthritis can occur in younger individuals due to injury or genetic predisposition, it is increasingly common as people age. So the age factor is a common determinant here. As people get older, the cartilage in their joints naturally breaks down and makes older adults more prone to osteoarthritis. So with respect to the options we've been given, our answer is option D. Osteoarthritis will most often affect people over the ages of 40. Question 12. Mr. Mark has a condom catheter. Elastic tape is applied. A. Using a spiral wrapping fashion. B. Around the penis in an overlapping, tightly applied fashion. C. To the abdomen and inner thigh. D. Around the testicles. A condom catheter is a type of external urinary catheter that is used to manage incontinence in men. The elastic tape or adhesive used to secure the catheter is typically applied around the penis in an overlapping, tightly applied fashion in order to prevent the catheters from slipping off and to ensure that urine flows properly into the collection bag. The tape is not applied too tightly to avoid constricting blood flow, but it should be snug enough to hold the catheter in place. Question 13. A respiratory tract infection is also known as A. Hepatitis, B. Hypertension, C. Influenza, D. Strep throat. Hepatitis is an infection that affects the liver but not the respiratory system, so that is not our answer. Hypertension refers to high blood pressure and it is not an infection, so that is also not our answer. Influenza is caused by the influenza virus and it can affect both the upper and lower respiratory tracts. It affects the lungs, airways, and other parts of the respiratory system. In option D, strep throat is a bacterial infection and it affects primarily the throat. However, it is not classified as a respiratory tract infection. So based on the options we've been given out of option C, influenza, and option D, strep throat, our answer is option C, influenza. It has symptoms like fever, cough, sore throat, body aches, and fatigue. Question 14. Mr. John has Meniere's disease. Which of the following is likely to be true? A. Hearing aids will correct this condition. B. Vertigo is a major symptom. C. He has a middle ear infection. D. He has vision problems. Hearing aids can help to manage hearing loss associated with Meniere's disease, but they do not correct the underlying condition, which is related to fluid buildup in the inner ear. Meniere's disease is a chronic condition of the inner ear that can affect hearing and balance. Vertigo, which is a spinning sensation, is one of the major and most distressing symptoms of Meniere's disease. It occurs because of the abnormal fluid buildup in the inner ear, which can disrupt the normal functioning of the balance system. In option C, Meniere's disease is not caused by an infection in the middle ear. It results from issues in the inner ear, particularly related to fluid balance. And in option D, Meniere's disease primarily affects hearing and balance, but not vision. So with respect to our options, we'll be going with option B. Vertigo is typically severe and it can last from minutes to hours, and it often occurs suddenly, causing nausea and imbalance. Hearing loss may also occur, but it is typically fluctuating in the early stages. Question 15. How can a PSW prevent regurgitation and aspiration in patients receiving tube feedings? For this, we'll be selecting more than one option. A. By allowing the patient to drink sips of cold water every 2 hours. B. By positioning the patient in a sitting or semi-phallus position. C. By checking the placement of the feeding tube. D. By allowing the patient to receive tube feedings while lying flat. E. By maintaining an upright sitting position for 1 to 2 hours after the feeding is complete. Option A is not related to preventing aspiration in tube feedings. The patients receiving tube feedings typically do not drink liquids orally unless it has been specified by a healthcare provider. Proper positioning ensures that gravity aids in the digestion process, thereby reducing the risk of regurgitation and aspiration. So, option B is likely one of our answers. The semi-phallus position, where the head is elevated 30 to 45 degrees, is particularly recommended during and after feeding. In option C, while verifying tube placement is essential to ensure proper feeding delivery, this task is performed by nurses or trained professionals and not by PSWs. In option D, it is unsafe to allow the patient to receive tube feeding while laying flat because this increases the risk of aspiration. The flat position does not prevent food or liquid from entering the airway. In option E, keeping the patient upright after feeding helps to prevent the backflow of food or liquid from the stomach into the esophagus, thereby reducing aspiration risk. So we'll be going with options B and E. These are the two ways that a PSW can prevent regurgitation and aspiration in patients receiving tube feedings. Question 16. A resident's wife asked the PSW when her husband was last seen by the doctor. The PSW should tell her A. That her husband has been doing fine and does not need a doctor. B. To call the doctor. C. To speak with the nurse in charge. D. That the doctor visits her husband often. As a PSW, you are not authorized to disclose specific medical information to family members without proper consent or unless it is part of your duties under the supervision of a healthcare professional. So when a resident's family member inquires about medical details like when the resident was last seen by the doctor, the PSW should refer them to the nurse in charge or another authorized healthcare professional. Nurses have access to medical records and they can appropriately answer questions regarding the resident's medical care, doctor visits, and treatment plan, all while respecting confidentiality. So our answer is option C. The PSW should ask the resident's wife to speak with the nurse in charge. Question 17. What should you do when your resident is NPO? A. Prevent the residents from having oral hygiene. B. Provide a variety of fluids. C. Offer fluids in small amounts. D. Remove all fluids from the bedside. When a resident is NPO, that is nil pillless, it means they are not allowed to take anything by mouth, including food or liquids. This restriction is often ordered for medical reasons such as before surgery, during certain treatments, or when swallowing is impaired. It is important to follow the NPO instructions strictly to avoid complications such as choking or aspiration. So the best thing to do will be option D, to remove all liquids from the bedside, which will ensure that the resident does not accidentally ingest anything while under NPO orders. This is a key safety measure. Question 18. Which organ produces bile? A. Pancreas. B. Liver. C. Large intestine. D. Small intestine. The pancreas produces digestive enzymes and bicarbonates to neutralize stomach acid, but it does not produce bile. The liver is the organ responsible for producing bile, and this is a digestive fluid that helps to break down fats in the small intestine. The bile is produced continuously by the liver and is stored in the gallbladder until it is needed for digestion. The large intestine absorbs water and electrolytes from undigested foods, but it is not involved in bile production, while the small intestine is where the bile works to break down fats, but it does not produce the bile itself. So the organ that produces bile from our options is option B, the liver. When food, especially fatty food, enters the small intestine, bile is released from the gallbladder to aid in the digestion process. So remember, the liver is the organ that produces the bile. The bile is stored in the gallbladder until it is needed for digestion. Then, when food enters the small intestine, the bile is released from the gallbladder to aid in the digestion process. Question 19. Which of the following conditions is characterized by the bone becoming porous and brittle? A. Osteoporosis. B. Kyphosis. C. Ewing sarcoma. D. Rheumatoid arthritis. Osteoporosis is a condition that is characterized by the thinning and weakening of bones, which makes them become porous and brittle. This makes them prone to fractures even with minor falls or injuries. The condition is common in older adults, especially postmenopausal women, due to a decrease in estrogen levels, but it can as well affect anyone. In osteoporosis, the bone density is reduced and the structure of bone tissue becomes compromised. Kyphosis refers to an abnormal curvature of the spine, which causes a hunched back, but it does not describe bone brittleness or porosity. Ewing sarcoma is a rare type of cancer that affects bones or soft tissue, but it is not related to bone porosity or brittleness. Rheumatoid arthritis is an autoimmune condition that causes inflammation in the joints, leading to pain, swelling, and potential joint deformities, but it is not what causes the bone to become brittle. So with respect to our options, our answer is option A. Risk factors of osteoporosis includes aging, a lack of calcium and vitamin D, a sedentary lifestyle, smoking, and heavy alcohol consumption. Question 20. When permanent damage is done to the spinal cord in the neck, resulting in paralysis of all four limbs and the trunk, what is it called? A. Paraplegia. B. Hemiplegia. C. Quadriplegia. D. Diplegia. Paraplegia is paralysis that affects only the lower half of the body, that is the legs and lower trunk, due to damage to the lumbar, thoracic, and sacral regions of the spinal cord. Hemiplegia refers to paralysis on one side of the body, and this is often caused by a stroke or brain injury, but not a spinal cord damage. Quadriplegia occurs when there is permanent damage to the spinal cord in the cervical region, which is the neck, resulting in paralysis of all four limbs and the trunk. The severity and extent of the paralysis depends on the level and completeness of the spinal cord injury. Diplegia is paralysis that affects symmetrical parts of the body, such as both legs, but this is often in conditions like cerebral palsy. So with respect to our options, our answer is option C. Quadriplegia, which is also known as tetraplegia, occurs when there is a permanent damage to the spinal cord in the cervical region. Injuries higher up in the cervical spine generally result in more extensive impairments. The symptoms of quadriplegia includes loss of sensation, movement, and function in the affected areas, and potentially loss of bladder, bowel, and respiratory control depending on the injury's location. This brings us to the end of Module 12 of the PSW NACC exam. Don't forget to like, comment and share, and also hit the subscribe button so that you'll be informed when our next informative video will be dropping. Thank you for watching, and I'll see you in the next one.